Hello and welcome to Beauty Talk with me, Cindy Nell-Roberts, and my beauty bestie, Denise Simba. Today we talk all things well-being from within, and IV drips is on everyone's lips. We are joined by two incredible experts in studio, Dr. Francois Ehlers, who has a postgraduate degree in aesthetic medicine and one of the owners of a very well-known medical and aesthetic clinic in Durban. Joining him is Dr. Vincent Ehlers, who is an internationally published author in hair transplants and management of hair transplants, as well as having a master's degree in the art of hair transplanting. We are so excited to talk about these topics. Welcome, gentlemen.
Hello, lovely ladies.
Thanks for having us, ladies. It's a pleasure to be here.
Sorry to cut you off, but I just have to say I've never seen two doctors this far in my life. Talk about Grey's Anatomy.
I mean, if the doctors are that good looking, you're like, okay, I want to hear everything that you do. What do you do?
What do you do?
We'll have 3 of that. Francois, let's start with you. IV drips.
Yes.
And vitamins.
You're
Beauty
right.
from within. What exactly is an IV drip? Tell us all about it, as if we've never seen this before.
Sure. I mean, if we're getting down to the basics, it's basically the delivery of vitamins, minerals, combination of antioxidants, and even peptides or stem cells in a sterile drip, basically straight into your bloodstream.
So you go into the clinic, you stick a needle into you, and then you feed the vitamins intravenously into the body.
Absolutely.
And why is that better than drinking vitamins?
So there's something known as bioavailability, the amount of medicine that's basically available to your body to absorb. So by administering these medications, vitamins, minerals, and so forth intravenously, your cells have the ability to absorb all of them immediately at 100%, making your body more available to energy and recovery.
Okay, speaking of energy, what would you prefer to give mothers who suffer from fatigue? Because I've got a 5-year-old and a 15-month, and I am tired all the time.
Yeah,
Well, so we have IV solutions available for a host of general concerns, and be this fatigue and energy, immune boosting, etc. But when it comes to moms, depending on how far post-pregnancy you are, sometimes it's very important to have a medical consultation and investigation first.
Okay.
So you do have general cocktails if we believe there's not really any underlying cause for it and you just need a bit of a pick-me-up. But there can be quite specific medical causes of fatigue that might need investigation. This could be iron deficiencies, thyroid problems, you name it.
Because I have an iron deficiency.
Is that a common thing that you see in people, iron deficiency?
absolutely.
And what is it that iron does that's so important?
So iron plays a very important role in the production of red blood cells. And you can think about red blood cells, what do? They carry oxygen around your body. So if you don't have enough oxygen around your body, you can actually feel fatigued.
Okay, that makes sense.
But in the same breath, when we're talking about moms, doing the heavy lifting and really putting in the time, I think a good prescription of some extra hours of sleep also goes a long way.
Yeah, but the kids, they're pulling one side and the other side and it doesn't stop.
That's why moms are superheroes.
Are there any side effects to IV drips?
So there can be side effects to it. So there's a couple of conditions. So if you have underlying cardiac conditions or kidney problems, then it wouldn't be safe to go ahead and do an IV treatment without first seeing what your kidney function is like, and to make sure that none of these are going to react with some of the medications you are already taking. So it's important always to go to a medical clinic where there is a doctor available to consult before this. Apart from that, during the process of the actual administration, yes, it can be slightly painful to get the IV if the skin is a little bit sensitive. You can get local reactions from the plasters to stick down the drips. These are really not very common though. And then depending on what is in the actual IV itself, this can cause things like a bit of dizziness if the IV is flowing a little bit too quickly. But we tailor this according to each patient to make sure that the experience is as comfortable as possible.
So
You go.
You go.
No, you go.
I go.
No, you go.
No, you go.
I go.
Okay. I am terrified of needles. Like, how do you manage with patients like myself? Because I have I make the craziest sounds. I mean, people think you're probably like butchering me. So how do you handle like clients like myself who are just terrified of needles?
So fear of needles is very common. I mean, it's one of the things we get most often is that people are quite apprehensive about the idea of a needle going into their arm.
Yeah.
I think it's all about creating a comfortable and safe environment. We have a nurse, her name is Sister Christelle. She's an absolute gem of a human being.
Hi, Sister Christelle.
Yeah, shout out to
Shout out,
Christelle.
definitely.
She really has the ability to make you feel exceptionally comfortable with a welcoming sort of persona. We have something called vocal local. So you can think of local anesthetic, and it's really about all the conversations as a distraction method that she has with you to kind of make you at ease before you have that kind of treatment.
They say that pain is 80% expectation and 20% sensation. So if you do distract some of the senses, I think that makes that a little bit of a more comfortable process.
I love that.
I love that.
Okay, so I've been to your clinic in the Pearls. And I mean, yours is exceptional. Lazy boys and drinks and IV bars. And it's like the
sounds like a
five-star
party.
Rolls-Royce experience. But where can we find these IV bars? Are they common? And tell me a little bit more about your clinic specifically.
I think IV therapy has had this global shift. There's this phenomenon of everybody seeking a quick fix, and people are taking their health more seriously in the modern world. And what we've seen is they're popping up everywhere on every single corner. But it's always important to do a little bit of research to see that it actually is a reputable facility with a medical professional that's there to administer these medications. Because in essence, anything that goes into your body, especially straight into your bloodstream, by definition, is a medication, even if it's an electrolyte fluid. So being able to have someone that can monitor you if there are adverse reactions is important.
Okay.
So there's been a big shift towards, like Francois mentioned, is people are taking a bit more of an interest in their own health. And this involves supplementations, performance enhancement, as well as longevity. Well, there's a discipline in medicine now known as performance medicine, as well as integrative health. So if you're not looking for a random IV bar where you might be uncertain of, is this reputable or not, then looking for an integrative health practitioner who's a medical doctor with further studies in this realm would be a good option, and they should offer it at their practice.
Which is what your clinic does. You have aesthetics, wellness, the hair transplanting.
So Aesthetic Options is a holistic clinic that focuses on wellness, aesthetics, as well as longevity, and we deal with regenerative medicine as well. So we have a host of different practitioners. It's myself, Dr. Francois, Dr. Lejean, we're all family. So we're the three doctors that lead the clinic, each with our own area of focus, and then we have a supporting team behind us who have their different expertise as well, be this in skincare, body shaping, hair removal, you name it, we cover it.
Amazing. Francois, you mentioned quick fixes. What do people come in for the most with IV drips? Is it to fix their hangovers or to train for marathons?
No, interestingly, not hangovers. I mean, now at the end of the year, when we have matrics all going on holiday, I'm sure more of them will be popping in for a quick fix to go to the next party. But generally, we see a lot of immune boosting patients come through. Those that go through the cold and flu season want a bit of a pick-me-up, and oftentimes your body gets depleted of its resources. And these IV drips can help to replenish those resources to fight off active infections. So we often see that. And then there's a large active community in the Durban and Greater Durban area. Those that like to do triathlons, such as Ironman, run long-distance marathons, those people all usually come for drips to help recover themselves.
Do you guys maybe have like a long-term program in your facility where, you know, it's not just a quick fix, but like just to kind of sustain the body, kind of keep it going, but almost not like too much in your clinic, but just like a long kind of sustaining program, if I can put it that way.
So I love that.
Yeah.
So I love that. And this is what we always preach. And one of the things we say is, be this aesthetics or wellness, is it's not a race to an outcome. It is meant to be a journey, an adjustment in your lifestyle. So we typically, with any treatment plan, will always recommend is we first try and see what is your end goal. And we can achieve that over sometimes as short as a month, but Usually a treatment plan is around about 6 months, and we progressively get you to where it is that you want to be. This allows no dramatic changes. It allows the process to be a little bit smoother to get there as well.
Okay.
Vincent, you are one of the top experts in hair transplanting. And so I think it's apt to ask you, are there vitamins and intravenous things that you can take that also help you with your hair, with your nails, with your skin? Does that work, or is it not really for that?
So most definitely. If you're experiencing hair loss as a result of vitamin deficiencies, usually this will always manifest as hair shedding. So actually seeing hair falling out and noticing on brushes, pillows, or towels. And very common things that this can happen with is iron deficiency, and we see this quite frequently when we do test for it. And apart from that, you need important vitamins in the body to be able to sustain hair growth. It's a rapidly dividing cell, much like skin is, and if you don't have the right ingredients to support it, your body's going to direct that elsewhere to take care of more important organs, and that's why the hair falls out. So things like zinc, magnesium, selenium, and vitamin D are very important to make sure that they're at adequate levels before we start looking at what can we maybe inject into the scalp, for instance, to grow hair.
Wow, that's interesting to have all of that.
I have a stupid question. Okay. But
There's no such
maybe
thing.
somebody out there wants to know about this. Is it possible to have a hair transplant, but with a different type of hair strand?
So do you mean
So like,
From
yes,
somebody
I've got
else,
a weave
or-
now, but underneath my weave, I've got like curls, afro. But maybe I just wanna go into this lifestyle. And I'm just tired of my little like curls that are taking years to grow. Could I go, hi doc, I really like Puerto Rican mamacita hairs. So could we just exchange what's going on here and give me some Puerto Rican mamacita hair?
So unfortunately, it doesn't work like that. So it is a surgical procedure, and hair, just like skin, is an organ. So that would be equated to taking just a random kidney and putting it in you. So the body wouldn't accept this hair follicle. It needs to come somewhere from your own body. So it's
Okay.
definitely possible to take facial or body hair and move it into different areas,
Okay.
but it has to come from yourself. There have been synthetic versions of follicles created that could give you that effect, but yeah, those can have some complications.
Okay, good.
Okay, we're going to lean more into hair transplant with a podcast with you, which I'm very excited about. But just bringing it back to vitamins for a quick second, we want to know, what do you guys take? Do you believe in oral vitamins, and which ones? And if you do IV drips yourself. So that's a mouthful. So let's start with, do you believe in oral vitamins, and which ones?
Absolutely. I think it varies from person to person what they need. From a genetic makeup, not all vitamins will be completely absorbed by certain individuals. And there are actually ways to go and figure out what kind of vitamins you need using genetic tests. So when it comes to vitamin supplementation, you can do a very deep dive into it. And I think we can chat here the whole day about it. But I do believe that there are certain fundamental vitamins that all humans need to at least get the benefits, whether it's from a general health perspective or cardiovascular health perspective. I myself do use a range of vitamins. Omegas is something that I use almost every day in the form of krill oil. I also use a product called NMN and resveratrol. Those are for anti-aging purposes. And yes, I do go for drips. It really depends on the kind of stress I'm experiencing in my lifestyle, whether I might feel a little bit under the weather from, a bit of a flu or a cold, or if I plan on doing some traveling, or if work's just been putting me under a lot of stress. Those are the instances that I'd go for a drip.
Let's talk about what is NMN, and I also want to ask you to tell us about glutathione.
Sure. So NMN is actually a precursor to something known as NAD. And NAD is a big buzzword around the world at the moment. The likes of the Kardashians are getting these NAD drips. And fundamentally what it is, it's known as a coenzyme. And it plays a very important role for the metabolism of your cell by providing energy. And unfortunately, as we age, NAD goes on a bit of a rapid decline. And people can experience all kinds of symptoms from that, whether it be brain fog, generalized unexplainable fatigue. And NAD helps to replenish those energy levels by providing energy to the cell. So it allows the amount that you essentially develop to be more when you supplement it orally. And glutathione is known as an antioxidant. It's actually used in medicine for liver detoxification, but it has other health benefits as well, including the removal of oxidative stress, which you might experience from lifestyle factors, poor sleep, smoking, hormonal changes, not getting enough sunlight. Those things can all create stress within the body, and glutathione helps to detoxify you.
Glutathione is also good for you who doesn't get a lot of sleep.
Yeah.
Definitely.
And no sun.
And no sun. Well, no, you go in the sun and burn yourself. You get too much sun.
Use often.
As you can see from my complexion, I don't go into the sun either. So my supplement regimen adds on vitamin D3 as well as the omegas.
Okay.
Okay, and vitamin drips, you also like them?
I do. So Francois and I work in the same centre, and I wouldn't say we're competitive by nature, but there's no ways he's doing something if I'm not trying it too. So typically when it comes to our routines, they are quite similar. The NAD drips do take quite a long time to administer because you can't run them at a rapid rate. This can be anywhere from about 2 to 4 hours, depending how you tolerate it. So for instance, it's quite challenging for me to take 2 to 4 hours out of the day in a busy clinic. Usually patients come there and they work on their laptop while having it.
Yeah, that's what I do.
So I rather supplement with NMN, which will create more NAD in myself orally. It just makes it a little bit more convenient for me to get it in.
And it's faster. I mean, it's not faster, but you don't have to sit there for long periods. So as long as you take it consistently.
We are now essentially microdosing NAD, okay, because we understand the pain point that people are leading busy lives, right? We live in a chaotic world. Time is money. So to sit for 2 to 4 hours can be cumbersome. So we can actually use smaller doses of NAD to make the intravenous therapy a little bit faster. It might just mean more frequent visits to get the total dose to experience all the benefits.
And then just quickly to finish off with, what kind of price range can people expect for vitamin drips?
I think when it comes to price, it's all about, what are you providing as a service as well? It's not just about what's in the drip. It's about expertise that you're delivering and also ensuring a safe and comfortable environment. Basic drips can start from about 1,000 Rand and then can go all the way up to about 1,800 Rand as you add more ingredients into them.
No, that's not bad at all.
That's not bad at all.
Not bad.
Can we do it while we're doing the show?
Yeah. Are you guys still here?
Makes sense. Thank you very much, Dr. Ehlers and Dr. Ehlers. That was very informative. And I think we now know everything we need to know about drips. And
Absolutely.
we need to get on the glutathione and the NAD.
And the NAD.
All of that. Thank you, everyone. That's all for Beauty Talk. See you next time.